What is the role for prehabilitation prior to autologous stem cell transplant?
What I tell my patients is like, if you were an athlete and you were going to the Olympics, you train, right? You train probably for multiple years. You go to the Olympics and then you may have an outlook for getting a medal, right? So it's kind of similar for transplant, right? The best shape you come to transplant, the better your outcomes in terms of like less deconditioning, right? And a faster outlook for recovery. So yes, what I tell my patients is like, I don't need to go to the gym, start lifting weights, running like 5 miles a day. What I ask them is like, schedule yourself to do some low impact exercises, right? What are those? Like walking. Walking is great, right? You can walk like about like half an hour every day, right? You don't need to be at once. Could split taking 15 minutes each time. You could do more than that. I would say half an hour a day, purposely walking. It's not like, oh, I have to walk to do. No, you purposely are going to walk. That's one thing. The other thing is like, these small weights or those resistant elastic bands are things that will help you to keep the tone in your muscle, especially in your core. So your respiratory muscles and those things, are very important to also be in good shape, right? I don't need you to build muscle. I just need it to keep them function, right? And then chair exercises, right? Like sitting and standing without using your hands, right? So that keeps these big muscles in your legs and your thighs active, right? So that you can walk, you can do. Because if you get sick during transplant and you spend time in bed, naturally we are going to lose not only bone mass, but we are going to lose a lot of muscle mass, right? And if we are not eating as we supposed to be, right, our protein ingestion is going to be significantly reduced, then that also impacts your muscle, right? So the best way you can prepare for that, the better.
What should people diagnosed with myeloma know about smoking?
Smoking, I would say, once you get diagnosed with myeloma, if you are a smoker, you should stop, right? You should make every effort. It's not easy. It's a very difficult thing to stop smoking. So there are multiple programs in many of the clinics. For example, here in Florida, even the state have a program where they help you quit smoking. There are nicotine patches, lozenges, other medications also, right, that will help you quick. And most of the clinics, including us, we have smoking cessation programs that patients can be enrolled. Also, there is literature on how smoking contributes to the resistance of therapy to the cancer cells, right? So that's also another reason to stop smoking, right? Yeah, stopping smoking is vital, right? And also, it will positively impact your respiratory system, right? You stop smoking, even though it's going to take a while for your lungs to fully recover, right? It's the right step.
What should individuals considering transplant know about alcohol use?
A low moderate consumption, right? Like a glass of wine, like with your dinner, is okay, right? Like, but if you are a more heavy drinker, like, like if you are doing like a 6-pack a day, that's probably not a good idea, right? You need to start coming down with those things, right? Because there are other things that are being affected by alcohol, right? Your bone marrow is affected by alcohol, your liver is affected by alcohol. So there are other things that you also need to be mindful, because you are going to be going through therapy, then you are going to go have a very life-changing type therapy like transplant, right?
Is there a role for physical therapy prior to the transplant?
If you are not able to do it by yourself, right? Like, for example, there are patients who have fractures in their spine, right? That produces pain. They may need to have surgery. Like, for example, those patients are excellent candidates for physical therapy. Basically, the prescription that I give to the patients is a physical therapy evaluation for strengthening and conditioning. And then they go to the physical therapy. They usually do this outpatient or at home. And then what I tell them is like, when you learn what the physical therapy is telling you to do, then you continue doing that. So as a way of keeping up with the activities.
Are there situations where prehabilitation could make non-eligible patients eligible for transplant?
Sometimes I see patients who are in a wheelchair. This is not a candidate for transplant at that time, right? But with physical therapy, with a pre-rehabilitation process, those patients can get off the wheelchair, can start walking, can have a good recovery, and then be considered for transplant.